still note taking that one.
Yeah, I would suggest.
Okay, so it's now 6:40, and I'd like to call the meeting to order. We do have a quorum with almost attorney Michael Iglesias, Monique Hardin Cordero, who's also our second vice chair, and me, LaQuita Henry. So we have a quorum. Um, can I to accept the agenda unless you see something in addition that you'd like to add? Did you get the agenda up here?
The minutes or motion to adopt the agenda?
Right now, just the agenda. Did you move?
Yes,
Michael Iglesias moved, I seconded at this point. So the agenda has been accepted. Of course, later on, if there's something someone notices and wants to add, we have 3 resolutions for the committee members. And Patrina, you didn't say anything, but I do see that you're there. Are you prepared for a letter of your letter of support?
Hi, yes, I actually sent it in to you. Can you hear me?
I hear you very well. You must have, I must have been in transit. Let me look for it. It's under your name, Patrina?
Mm-hmm.
Or is it under another, let's see.
Yeah, it's under the heritage, but I think I also emailed you, so take a look at what I emailed you.
Okay. And then I'll see if we can get it printed.
If you need me to come up the hill, I can come up the hill.
I do, it would be great if you did, but I see it here. Let's see. Let me see if how, if I email it to you, will you print it out? The letter of support coming from, Heritage Health and Housing. I do see it, Katrina. We haven't had a chance to read it, so at the time, I'll say 5, because there's 3 of us here now. I'm expecting Heather at least. Let's see. Kill.
Is it sent to me also?
Okay. I'll send to both.
You sending it to me also?
Uh-huh.
Okay, go ahead, Raquel. I
Let's
got
see,
it.
Russell. Oh, it's a letter of support. Michael, can you take a picture of the names of people, the participants online? Okay, thank you. Okay, I emailed it, so at least the committee is the one that votes on it now, so when it comes through, it'll be printed out for us. Part, once we get a letter of support under resolution. Is there anyone else? Is there anyone else who has any addition like that, letter of support or resolution that they'd like for us to consider? Okay. And then it's from the March meeting will fit in March and sent to the executive committee, but we did it offline. So they've already been approved, but I put them here for our agenda. And I want to thank Dr. Torres again for taking the March minutes for us.
Did you see my comments?
On the minutes.
Right, there was a correction.
So can I get a motion to approve the minutes as corrected? We'll just do it since we're running very late. Do you want to move that? Quickly, very fast.
You mean to say what the edit was or to
If
move
it's
it?
real quick.
Yeah,
We'll just,
Yeah, it just, I was marked as absent instead of excused.
Oh, okay,
That was it. Everything else was fine.
okay. And so, and Monique was excused. I think we even mentioned it. Okay. All in favor of minutes, being accepted as corrected? Okay, I'll make my notation.
Aye.
Okay, let's move, directly to New York City Department of Health and Mental Health. I see Pauline Ferrante is here. Hi, Pauline. What's happening now with, that we should know and the community should know, at DOHMH?
Hi, good evening, everyone. Nothing too major to report. I'm sure everyone's heard about the measles cases in Texas and Arizona. Currently, as of the 4th, there were 3 cases in New York City. But again, we encourage everyone, especially parents, to have their children receive the MMR vaccine. It is on a
Thank you.
schedule. And we really would like parents to, we saw after COVID a lot of kids falling off their vaccination schedule. So we're really encouraging all parents to speak to their pediatrician and make sure their kids are back on track. Again, all city school age children that attend city schools must be vaccinated. So it's not a huge problem. However, we just want to make sure that everyone is aware of their own vaccination status. And if you're traveling, to look on the state's website to make sure that you are traveling to a place and if you need to take precautions to do so. So that's the biggest update. Nothing else, but I'm happy to take questions.
The only thing is there are people who are traveling with measles and they land and I don't know if they discover later, but there's that kind of episode. Are we doing any kind of promotion, when I say we, DOHMH, on vaccinations sooner rather than later?
Yeah, and that was gonna tie into my question in terms of your comment of knowing your vaccination status and whether or not people have to get boosters, MMR boosters, if it's been a certain amount of time. I
So
don't know if you can
yes,
answer that.
so with regards to boosters, yes, your body does naturally metabolize, certain vaccines. So you can ask your healthcare provider to give you a blood test, and you can ask specifically to check for your immunization with regards to measles, mumps, and rubella, and they would do that for you. I know that I had to get like a procedure a couple of years ago, and they checked my blood work and they said that I needed an MMR booster. And so I did get one at that point. So you should talk to your healthcare provider if you're not sure or if you just want to double check. We definitely encourage that. But again, with kids, to enter school in the city, you have to have those vaccinations already done, both of your doses before you start school.
And what about promotion? Has any promotion come out? Even though it's early, it still would be time now for information on vaccines. Are you, do you know
There's,
whether or not a
yeah,
promotion
I
is
mean,
being prepared? Or
we have information on our website, but I don't know if there has been any plans for like a large scale like media campaign, for example. But I'm happy to circle back with our media team to see.
that would be great. It's interesting today because RFK Jr. stated after the second measles death in Texas that he is now encouraging people to get the vaccine, that it is the most effective, you know, cure for the ills of measles, a simple, not simple disease, but one that had been eradicated. So, I mean, he's kind of talking, out of both sides of his mouth, but for the most part, his message is that the vaccines, that they will be promoting people getting getting their children vaccinated.
Yeah,
I'm
I
also
will check
concerned
with our
about other
team.
vaccines, so I'm hoping.
Sorry,
Okay,
Laquita, I didn't mean to
in
cut you
reference to
off.
other oh, go ahead, Pauline.
No, I'm sorry. I didn't mean to interrupt. Yeah, no, I'm more than happy to check in with our team about any sort of educational materials, and I'll be happy to send you anything that we have.
Terrific. Anything from our guests or those who are online, our participants online with us? I always ask Heather to check her hands up because I might miss them now that she's here. Okay.
I'm just wondering, and maybe I didn't hear it, is there any current information about COVID in New York City or in Community Board 9?
Right. There seems even though it seems like things are happening elsewhere, but we have things that are happening here in the city also. And I don't know if they're intentionally kept a little low key, but is there anything on COVID? Because I've heard, the last couple of months, so many people with COVID, particularly,
Really?
yeah, particularly uptown.
Yeah.
Oh. So Pauline, is
Uh,
there any, if, on how, what the statistics are with COVID?
Sure. I mean, we still are tracking data on our website with regards to COVID. Trends. So let me just pull up our website really quickly just to double check. I apologize that I didn't have this prepared beforehand. But on our website, there is a tab for COVID, and it has all the data available by neighborhood and by zip code. So let me just quickly pull up. So in the last 7 days, the total cases for all of New York City has been 516. Hospitalizations have been 34. And then there was unfortunately a COVID death, one that was attributed to COVID. And this data was last updated on April 3rd. And then let me just check by neighborhood.
And
So
what you just reported was for New York City?
yeah, New York City as a
Okay.
whole. Let me just check. I don't see your zip codes as one of like the top neighborhoods that are seeing hospitalizations for COVID, but let me just, go through the list to see.
And is it possible that some people they just take the COVID test that they get and just stay
Correct.
home, or
That's
is it
correct.
possible
Yes.
that
Yeah.
it's not reported?
Yes. That's
Uh,
absolutely
yeah, and just
possible.
to chime in, hi, and thank you very much for allowing me to participate. My name is Mike Hernandez. I'm with Public Health Solutions, and I formerly was in charge of our COVID activities at Public Health Solutions with the T2 and the CDG grants. And I can tell you that you are absolutely correct, and Pauline is correct. The information is just not being captured
Welcome,
anymore.
Michael. What can you tell?
Well, again, the information is not being captured because a lot of people, even if they test positive, they don't report it to the state. Oftentimes, they don't report it to their doctors. And there are many instances because, and this is a nice testament to the fact that the vaccines have worked. If they do encounter COVID, the symptoms are so mild that they don't even think that they have COVID. And so it's one of those 6 of one, half done of the others. We become victims of our own success. But the reality of the matter is COVID is still present. It's just not as rampant as it was before, and B, it's way under reported. And I think that we will probably see more cases of long COVID before we see large cases of COVID. And Pauline, I'm sorry, I didn't mean to step on on your stage there. I know that the Public Health Corps does release this information, and it's regular monthly meetings with its grantees.
Yeah, no problem. Thank you so much for sharing.
I
Yes,
would
and
also
I
add that
that
more people have died from the flu this year than COVID. The last time I checked back in February, 13,000 people had died from the flu. So it's very important for people to get vaccinated. Yeah,
And the
for
flu
both.
shot, the
Mhm.
flu shot you're speaking of too, yes. Thank you very much for that input from everyone. Okay, and Pauline will talk to you and look to hear from you in May.
Sounds good. Thank
Mhm.
you so much.
Um, the WHDC grantee Harlem United, I'm so pleased that, Nicole, well, I don't know if it's Nicole who's going to present, but that I was in touch with Nicole Motley Barnes, who is the Institutional Giving Officer and in the area of strategic advancement. And she and her team from Harlem United, well-known organization in the area, will talk about the grant that they received from West Harlem Development Corporation and how they hope to use it and have used it this year. Will you need me to make you a co-host, Nicole?
No, you
No?
mentioned you wanted me to make it fast because you have a lot of things to do. So I will make it very quick for you. You don't have to do that for me. Thank you. Okay. Can you hear
Well,
me? Okay.
welcome. So I don't know if you
Thank
have
you so
others here
much.
with you. You can reference very well. Okay.
Thank you.
Okay,
Thank
so
you so
go
much.
ahead.
So good evening, everyone. Thank you so much for having me. As mentioned, my name is Nicole Barnes, and I am the Institutional Giving Officer for Harlem United. And we are very grateful to be the recipients of a $25,000 grant award and first-time grantees of West Harlem Development Corporation. So this award is directly supporting behavioral health, academic programming, and access to technology for the parents and children who reside in our New Broadway Family Shelter. So our family shelter is located in the Manhattan Community Board 9 on 540 West 126th Street. And it's a 71-unit emergency family shelter where families with children can reside for up to 2 years. And given the length of their stay, we try to provide them with as many resources as possible to make sure that they're feeling, good about their transition into housing. So the funding from West Harlem Development Corporation had substantial impacts to our behavioral health programs, supporting play therapy for our youngest children, art therapy for children from 4 to 14, and then we also have group therapy for middle school and high school age children. The benefits that we see are reduced isolation among our parents and their increased engagement with their children, working through trauma, anxiety, and naturally revealing concerns, fears, or other sort of hurdles that they need to confront. But this grant also helped to increase access to technology for our residents with the incorporation of a computer lab. It's in a recently renovated community space that's a storefront on 11 Old Broadway. And this increased access to technology has helped to provide a working space for parents and school-age children. So during the fall, we found out that about 53% of our school-age population had lacked fluency in English, and there was an overwhelming concern from the public schools that they were attending, and all of which are in CB9. They're all CB9 public schools. So the access to technology has allowed us to implement more computer-based academic supports and also provide like a space for virtual and in-person tutoring. Thus far, we've had 110 residents who have directly benefited from the program, 62 children, of which 52 children were school-aged, and 48 parents. So we're just so grateful to the West Harlem Development Corporation for their support. And also just grateful for Community Board 9, Health and Environment Committee, for allowing us to speak this evening. Thank you.
Any questions for Harlem United?
Quick one.
What is it? What is the capacity?
How many families?
Oh, I'm sorry. Well, the capacity is 70. We have 71 units, but the capacity is up to 100 and we could probably fit around 170, but it ranges because we have some studios, 1 bedrooms, and 2 room sort of units there.
So what, how many people or families are there currently?
The last number I received was 181.
Did you hear
I'm sorry?
the, on the 81? I'm sorry, I didn't know if you heard the question. You said 181 families?
No,
That facility,
there would be
181?
71 families, but the total comes to 181 when you, yeah, so,
Children.
Individuals as well, okay.
Spouses.
yeah,
So,
individuals, yes.
91 families, okay, got it.
Okay. Is Harlem United still also an maybe you said, and I jumped up
Yes.
to change something on the screen, HDFC?
FUHC, yes, we are. We have two health centers, one on 124th Street and another on 133rd.
Are they both in central Harlem?
They are, yes.
Okay, I mean,
But we
that's
do
okay, I just wanted
serve CB9 residents,
No.
of course.
Right, so when you say 130th Street, do you know what avenue, can you say?
Yep, it's it's closer to Adam Clayton Powell. So yeah,
Okay,
it's
so
about
near Seventh Avenue, and the one at 124th?
Yep, and that's closer to Lenox. So it's in the middle of the block, but
Okay.
it's much closer to Lenox Avenue.
Okay. Any other question for Harlem United? And it may not be your specific area, and again, you may have said this, but do you have a primary your primary deliverer of services to those with HIV/AIDS?
So Harlem United was one of the first people to serve people living with HIV and AIDS in Harlem, and we still do. That's a large part of our population, and they receive housing, of course. We follow a housing first model, but then they are also receive healthcare as well. They're primarily served from our adult day health center at this point. That's where you would find a lot of the services, and that also includes the Willis Green Health Center. So it's all located within one space.
They were really, that was such a great and very important achievement. I remember back in the day, and so we appreciate very much the legacy of Harlem United, helping those, who really, really needed at a very important time when there was a lot of stigma and, people just didn't know as much, and you guys stepped in and met the moment. So I'm glad that that's moving forward, and hopefully, those numbers are decreasing, although I understand statistically that may not be so in terms of New York City and in Harlem, particularly among Black women. So we
Yeah.
probably need to have something that focuses on that, and we'd like to hear the story from you. So whoever I should talk to come and see how we can get the word out and be of service, please let me know.
Oh, I will absolutely.
Okay.
Yes. And thank you so much for saying that, because it does mean a lot when long time residents remember what the work that we've done. So thank you so much for saying that. And yes, we will definitely come back and speak with you
Yes,
all.
and thank you. And we put forth a resolution end of 2024, was in June, in support of that particular health challenge because services were being financial aid was being cut. Against those cuts, funding was restored, if I remember correctly. And if I'm
Yes.
not, okay, I was
Those have
hoping
not
so.
impacted us, but we're still waiting to see what happens, you know, over the coming months.
Yeah, we're in a time now. Right. Okay, thank you, Nicole, and thanks
Thank you
for,
so much. Thank you.
okay, and I don't think I see any other questions that are out there. Is there another West Harlem Development Corporation grantee here who has not presented? I know I have Northern Manhattan Improvement Corporation's name down, but I do believe that they were in the public session at Community Board in March. I may be mistaken, but there may only be one. And if that person or representative of that organization is present, please let me know. Okay, and I see no hands. So, all right, so we'll move forward. Just to reiterate, we had a West Harlem Development Corporation awarded 12 grants this past within this fiscal cycle and in the area of health and human services. And we definitely had 10 present to us, and in a very timely way. Most presented, let's see, December, we had about 3, January, February, and March. March, there were only a couple, and then tonight, one. So we met our challenge of having you come to us, and we have a couple other programs that we'd like for you to participate in before the fiscal year's up, and that will be very important to us. One of those programs, it relates to Medicaid, and we have a couple of representatives here who will talk about that. They're from the Public Health Solutions, but not right at this moment. And then there's another project also that we're hoping you can, it will give you something else that you can say in your grant related to Community Board 9. It will be very important. I would like now to call on Miss Julia Meyer, who is supervisor of the Children's Single Port of Access with New York City Department of Health and Mental Health. And I want to thank Darren Hoke for introducing us to the rest of his team or those he works in close conjunction with at DOHMH, and through him and our discussion and concern about children at this particular, in terms of mental health and children, you know, he came to the fore, and it's very important for us to know the departments where we may be able to lend some, not so much expertise, but expertise in some ways, but certainly be able to take your information back to our community. And so through him, we met Julia Meyer. And Julia, I know you have a team of people here. We'd like for you to introduce, say more about yourself and your department and team and what the department does.
Yeah,
and Julia, I have you, I've made you a co-host.
Yes.
So that if you have a presentation, you're all set. And just so Carlos, if you want to get ready, I've made you a co-host as well for the time, when your time comes.
Okay. Are you able to see the slides?
Yes.
Awesome. Great. So my name is Julia Meyer. I'm the supervisor for CSPOA, Children's Single Point of Access. One of the CSPOA specialists, Ricardo Rodriguez, is also on the call with us as well. So today I'm just going to give a brief overview of our program, what services that we connect to in the community, and yeah. We'll have more information online, and I can send some application documents as well. So just to start with an overview, we have children's single point of access. So we're a centralized referral system for children with serious emotional disturbances who need mental health services to remain at home or in their community. So we can direct youth ages birth to age 21 to a variety of community-based services, both in-home and out-of-home services. And basically how the process works, we're the referral hub. So we receive the referrals, make sure it has all the necessary paperwork and information. And then we have a CSPOA specialist, so that would be Ricardo or someone else on our team that would review the referral and determine the most appropriate level of care for that youth, the most appropriate service type, given what's going on with that youth and the family, along with interviewing the family and the referral source. And then we connect to those services in the community. Typically, we have a quick turnaround. So once we receive a referral, as long as it has all the necessary paperwork, we can make the determination within 5 business days and reach out to the family and the referral source within 5 business days. And then we can connect the agency as soon as possible, though there are some services that there are wait lists for. So we process referrals for all of these 7 services. So they're listed in from least intense to most intense. So we'll get into some of the service components just briefly for each one. But we have health home care management, non-Medicaid care coordination. Those are the 2 least intense services that we have. Then we have high fidelity wraparound, youth assertive community treatment or youth ACT, community residents, refocused community residents, and residential treatment facilities. So we are the single point of access for all of those services except for health home care management. So if there's a youth or family that want to access one of the bottom 6 services, they would have to go through us to be able to access that. So health home care management, just briefly, we'll get into some of those service components. So the care managers can refer the child or youth to services, help schedule and manage the child or youth appointments, supporting the families and understanding how to manage healthcare and social needs. And they also can determine eligibility for the children's waiver, home and community-based services, or HCBS. And non-Medicaid care coordination is basically the exact same as service, but it's for youth without Medicaid or without insurance. And so those care coordinators coordinate the child or youth's physical and behavioral health care, develop and manage individualized plans of care, link families to community resources, and help schedule and manage the child or youth appointments. So typically for both of these services, it's usually a visit or 2 a month with that care manager to provide that support. And then we have high fidelity wraparound. So this is a little bit more intense than those other 2 services. So it's basically 3 individuals that work together. You have the care manager, you have a family peer advocate, and a youth peer advocate that are offered to the youth and the family. And those 3 individuals kind of work together to provide these service components. So creating a plan to help prioritize and meet behavioral health needs, improving the family's ability to manage their own services, develop and strengthen the family's natural support system over time, and integrate the work of all youth serving systems, natural supports into one organized and effective plan. Currently, high fidelity wraparound is not available in Manhattan. It's only available in Bronx, Queens, and Brooklyn. But at some point, hopefully it will be available in Manhattan. And then we have Youth Act. If you've heard of Adult Act, this was developed very similarly. So it's basically a team of people that work together to support the youth and the family. And so they have that psychiatric nurse practitioner that comes in the home and does the medication management. They have the licensed mental health professionals that come in the home and do individual and family therapy. And then they also have clinical support specialists, program assistant, team leader, and peer and family advocates that can provide that psychoeducation, the crisis intervention, the peer support services, and the vocational and educational services. So basically this program is all services, all community-based services in one program. And it is very intensive. It's at least 6 visits a month with someone on the team. And then we move to the out-of-home services. We have 3 out-of-home services. The first is community residence. It's basically a therapeutic group home where 8 youth live and they live there during the week. They visit with families on the weekends. They'll stay with their clinic, whatever clinic they're connected to, stay at their normal school. But basically, this is a separate location for them to live and kind of work on that family work on training and problem solving skills, work on social skills, daily living skills, coping skills. Typically, the stay at a community residence is around like 6 to 9 months. Unfortunately, there are no community residences in Manhattan, but they're in all 4 of the other boroughs and in the rest of New York State as well. And then Refocus Community Residence is the newest community residence. There's only one, and it's located in Queens, and it's for the older youth. So it's ages 14 to 20. And so this is for more focused on that pathway to independent living. So they're doing life skills, peer advocacy groups, working on employment, vocational plans, educational plans, and helping them reconnect with family members and building an informal support of peers and adults. And then finally, we have residential treatment facilities. There are 2 in New York City, one in Queens and one in Brooklyn. And basically, it's a one-stop shop. It's where the youth would go to school. It's where they would receive all medical services. It's where they live. They get their recreational, vocational services. Typically, it's considered after community-based alternatives have been tried. So this is the highest level of care outside of inpatient hospitalization. And so typically there needs to be an attempt to try some of those in-home supports. And it's for youth ages 5 to 20. There are also residential treatment facilities throughout the rest of New York State as well. We are the children's single point of access for New York City, so all 5 boroughs, but there are single points of access throughout New York State as well. And then you can find our contact information on nyc.gov/health. You also have our phone number here. But I know that was very quick. Online, when you search for CSPOA, you'll see like the paperwork requirements for each of the services to apply for them. But yeah, I just wanted to give a brief overview today for everyone. That I am open for any questions that anyone might have.
And again, you may have
Question,
said it,
Laquita.
but it went
I have a
kind of quickly.
question. Yes. Do you take youth that are
okay,
involved in the
sorry,
criminal
my-
justice system?
Oh, sorry. I feel like there was other stuff. So yes, so we have in-home services. So if youth is residing at home, typically if youth is in a detention center or some location that's not at home, we have to wait until they're discharged to a home-like situation.
Okay.
Yeah.
Okay, great. Thank you.
Said yes.
Julia,
Yeah.
I have a
It
question.
sounded like it was
It's
confusion,
something
though.
with the sound, because there are questions over, there's an overlap. But anyway, I was just gonna ask how you get your clients, and you may have, because I missed that somewhere. How do
Yeah.
these children get to you?
Yeah, so we
Julia, did
do
you-
presentations constantly. Yeah. Sorry, there is a delay, I think. Somebody's in, my end, your end, I'm not sure. But we do presentations constantly. Typically we get a lot of our referrals from hospitals, inpatient hospitals, because the youth need those supports when they're discharged from the hospital. We also get a lot of referrals from schools, from outpatient clinics. We've been around for 20 something years. So typically people in the mental health world kind of are aware of us. But we also, like I said, we're doing presentations constantly. And all of our providers that we connect to do presentations as well.
So hospitals like in our area, Harlem Hospital, Mount Sinai, Columbia Presbyterian.
Correct. Yeah. And Mount Sinai also, they provide some care management services for the youth that we work with, and non-Medicaid care coordination as well. So yeah, we definitely get referrals from all of them.
I had a
Now,
quick question.
there's,
Oops, can you hear
yes,
me?
yes, is that Victoria?
Yes, it is.
Hi, Victoria. Okay, go ahead. Welcome.
Thank you. I'm just curious. I noticed for one of the residential programs, I heard the lower age is 5. So the first thing that popped in my head is, how do you keep families involved with children that young?
Mhm. All of the out-of-home services are very family focused. So whether it be the family comes to visit, or the youth comes home to visit with the families, they want the family involved as much as possible, and that's very much an agreement that has to be like an agreement that's made at the beginning of treatment. So it's definitely none of the services are placement, like they would be potentially considered through ACS or anything like that. They're very treatment focused. So that's why family is a priority in that.
Thank you.
Let me just make clear that for out of home, the youngest is 8.
Got it.
8 and up.
And if I might ask, for those referrals, are they using a tool like a Unitas or NowPow, or what types of service referrals are they using?
So we have an online system that they can submit referrals to, or they can email. Are you talking about like submitting the referral?
Yeah.
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 So we have an online system called Maven
Got
that
it.
we're working toward having all of our referrals be submitted online, but we're a little bit behind. So, but right now they can use Maven, but we typically get most of our referrals via fax or email, encrypted email.
Thank you.
Mhm.
So it seems like with the hospitals, in particular, that they don't have enough, or it takes a long time to get an appointment or to get help or to have, the client or the patient would, or, yeah, the patient, referred to. I guess my question is, how fast do you find, I know you just mentioned you're behind a bit. How can that be rectified? Because there's so many children that seem in need. Is there a need for more psychologists, psychiatrists, therapists? We're trying to get a sense of what's happening there. So that they're not don't have such a long wait time and not have their issues or problems be worked on.
Yeah, absolutely. We definitely hear that from our perspective.
Mhm.
From our perspective, we will assign to at least the lowest level of care so that they can get that support immediately, right? So I mentioned at the beginning, once we get the referral and it's complete, we have 5 business days to reach out to the family, reach out to the referral source, and then we connect that family, if they're in agreement, to at least care management, so they can get that support pretty like within a week or 2. It's the more intensive services that have longer wait lists right now. And I think, historically in the mental health world, finding staff has always been hard. But we connect the youth and families to some sort of support along the way. Ricardo, did you have anything you wanted to add?
No, I think you pretty much said it. I think it's just historically, mental health field has been a difficult one to navigate and to find staff. Specifically for one of the newer services, Youth Act, has been very difficult for any program to
Say that
retain the
again,
staff.
Ricardo. Can you say that again, what you just said? What's more difficult?
For Youth Act, one of the programs that Julia alluded to before, which is the one that you get a nurse practitioner, care manager, a therapist, the one that requires a minimum of 6 visits a month. For that one particularly, it has been very difficult to retain staff. So that's where you find most of the wait list. But again, as Julia indicated, we try to connect the families at least to the least intensive service, which is health home or non-Medicaid care coordinator, so they have some sort of support. If they're not able to get into Youth Act right away, for that care manager to try to link the family to any services in the community.
And the youth app, those ages from what to what age? What to what year? Because one of your programs, 8 to 14, I saw that. So the youth app program is what age? 16
Youth
to
Act,
21?
Youth Act is 10 to 21.
10 to 21.
Correct.
Yeah, I think I sent a reference guide, I believe, Laquita, to you, but if not, I can resend it. But we have all of the more detailed information in the reference guide in regard to like ages, what paperwork needs to be sent for what service. And it's 2 pages, or it might be, it's a couple pages, but it kind of condenses everything into a PDF. Yeah, because the PowerPoint, I eliminated some of the slides just for time.
And I
Sometimes
always,
you
let me just,
hear how it works though, because you can see it on paper, but you know, we know it's something that's very challenging to work with when we're talking about young people, and sometimes we have to hear it, and it's, you know, on paper it looks easy, but we know it's a tough job. How do you rate success in
I
working
mean,
with
so
that could be,
like,
you know, strange.
yeah,
What makes
yeah.
it, how you measure success?
Yeah. I mean, each program has oversight by different agencies. So some are overseen by like Department of Health and Mental Hygiene, some are overseen by the Office of Mental Health. So they have their own like specific ratings for like how they determine success. But I think just in general, a note can be made for all of the services that we connect to is that engagement is a huge part of it and a huge focus. And so all of the agencies that we work with, all the care managers and workers and everyone, their first step is focusing on engaging, because we know it can be a struggle, and especially with all of these services being voluntary for youth and families, they have to make that extra step to engage. And so there's also not just a one-time conversation, they say no, we're done. They do that, make that extra effort to confirm, and kind of like, you know, help them see that this could be helpful. Does that kind of answer your question?
Any other questions? Do you work with other organizations or other than what you have on staff? Do you contract with others to assist the work that you do?
No, our team is fully within the Department of Health and Mental Hygiene. We have myself, there's a director, we have 4 specialists who are the ones that review the referrals, 2 referral coordinators, and then a family advocate. So that's all in-house. So all of the processing of referrals is within our program and stays within department.
I was gonna add that given the constraint with mental health workers, we have Heritage Height that has a pretty robust program in the community, and they can get access pretty quickly to the clients. I know that I see Sandra here, but they have been you know, establishing a mental health program that has been very successful.
Are you familiar?
Oh, we have Dr. Milano here.
Yeah, so in any case, we have a fully bilingual Spanish board certified child and adolescent psychiatrist who is part-time. So I will put my information into the chat so that you can call me, you can email me, because there may be times when you need a Spanish speaking psychiatrist who's board certified in child. So you probably will maybe find a handful of those in New York City. So thank you. I look terrible. I'm putting my
No, that's fine. You're fine.
Thank
Um,
you.
And then also, Julia, if you drop your information in the chat as well, and Ricardo.
Yeah, absolutely.
I was just gonna say that if anyone, there's nothing that you have to memorize here. If you have any questions, please reach out to us. If you have any questions about a particular client, anyone, any user struggling to find any services, please reach out. Reach out to me particularly. Julia has a lot on her plate. So if you can reach out to me, that'll be great. I don't know, Julia, or I could add my contact information in the chat and reach out to me directly.
Yeah, absolutely.
Oh, I saw another hand up, but it's not there now. Okay. Thank you very much and for taking the time to talk to us. And I know you have other areas that you work within, and we'd love to hear about those so that we can be more aware and be able to give information to our constituents. And if you have a brochure or other, maybe you could send a few to our community board office so that we can have them here. Because people do drop in from time to time and look at the materials that we have.
Yeah, absolutely.
Okay.
Thank you so much for having us. But I will send whatever information I have. We're working on a brochure, but it's in development. So.
Okay. Okay, good luck with that. Okay. Thank you very, very much. And now we have a topic of Medicaid, which has been in the news a lot lately. I'm not sure how much Public Health Solutions will touch on some of the issues that are facing us with Medicaid and what we need to tell our public. So much is unfolding, and now with this new federal appointment of Dr. Oz, we don't know how that's going to shake out, but however way it shakes out, it will affect us. Before, well, our committee has been really, we try to be on target before certain things happen. And we had a group represented by Dr. Evelyn Rice and Victoria Penderhughes. And did I say Evelyn Rich? Dr. Evelyn Rich, who is a principal at the school, but they're very active in their union. And they came to us wanting support because there was this push for Medicare Advantage. And so we actively got involved, informing our committee. They presented to us. I know that's different from Medicaid, but it's kind of like in the same area. So we do try to be active on all levels because everything affects us or somebody in our community. And these are large organizations with great impact. So they presented a resolution that we supported. And that resolution was presented to not only sent to the persons involved with their union, but to our legislators as well. So I think we were able to have some impact, but the issue is not resolved. They're here tonight, and we want to hear. I know Public Health Solutions has another angle, but dealing with the public and making sure people are aware of Medicaid. So we have Carlos Morales here, and we talked earlier to Michael. So you guys take it away. I think I have both of you as co-hosts so that if you have presentations, and we're doing pretty well. So it's 7:34. We want to try to have questions and everything completed in a 20-minute, process. You give a presentation and we have questions and answers. Questions and you provide the answers.
Awesome.
We will try. Thank you so much. All right. Carlos, if you go ahead and start the presentation. And I do want to thank everyone, the committee, for allowing us to present tonight and share some information. And of course, it's always good to see familiar faces. Danielle, good to see you again. And of course, our partners that we have in our SCN that are represented here tonight, also that are part of the Community Board 9. So without further ado, my name is Mike Hernandez. I'm the Community Engagement Manager with Public Health Solutions. And Carlos Morales Hernandez is my colleague. Carlos, would you like to say hi and introduce yourself, please?
Hi all, my name is Carlos Morales Hernandez, as Michael shared, and I'm the Senior Communications Specialist. It seems I'm having some technical issues on my end when it comes to putting up presentation, but I'll let Michael take the lead on this one.
Carlos.
Yeah.
Something's going on. You're coming
Hello?
through where it's extremely muffled. It's almost like we're missing what you're saying. I don't know if you're too close to the mic. Something's going on, but it's hard to. Michael was very clear, but something's in your system where it's very muffled.
I just talk loud. Okay.
No,
So
it's,
what?
I don't know if the others heard it, but maybe away from the mic a bit. I'm not sure.
Okay.
Okay, but go ahead. We'll.
Okay. I don't see how I can. Oh, here we go. I'm going to try and share our presentation, and if it doesn't work, it doesn't work. I know it inside and out. Okay. Okay, let's see if this works. Okay.
Oh.
Okay, can everyone see my screen?
Yes.
Can people see my screen?
Very nice.
Excellent. Okay, so thank you again. So I'm not going to go through the agenda. I want to go ahead and just move through this, and we can take questions, and then I can go ahead and give you all the information, hopefully, that you will ask. So again, my name is Mike Hernandez. I'm the Community Engagement Manager for Public Health Solutions, and I'm joined with my colleague, Carlos Morales Hernandez. He's our Senior Community Engagement Specialist. We are not related. He's far better looking than I am, than we could ever say that we're related. So for those of you who are not familiar with Public Health Solutions, we've been around for over 60 years. We began as a service arm of the health department in really trying to do research and analyses of information, and then subsequently moved to being a programmatic arm of the health department, as well as other, organizations throughout the state. And so we really spend our time trying to help vulnerable populations improve their health so that way they can lead the most healthiest, productive lives they can. Cutting to the chase about why we are here. We're here to talk to you about our Whole U NYC social care network. And last year, we were awarded 3 boroughs in New York City, Manhattan, Queens, and Brooklyn to oversee the state's 1115 Medicaid waiver. And the purpose of this waiver is really to help bring services to Medicaid members who are eligible to receive, referrals to help them meet their unmet needs. And I'll go into a little bit about that. So as the lead entity, our real first foremost, role is to coalesce a group of organizations to help do screening, to help do navigation, and provide delivery of services. And I think I might have lost the presentation. If I did, I apologize. Don't need it. Again, I know it. Some of our partners do include Safe Horizon, the Fortune Society, as well as Goddard's Riverside Community Center, and of course, Harlem United. We work primarily with these partners because they are the trusted entities in the community. And it is very vital for us to be able to reach the 2.6 million New York residents that are currently in Medicaid. And so again, our role is to screen and navigate these individuals, especially if they are eligible for the enhanced services. And the enhanced services fall into 3 buckets. That's food and nutrition, as well as housing and transportation. In the food and nutrition, it includes everything from medically tailored meal to prepared food boxes to providing them with assistance with pantry supplies, as well as pots and pans, things of that nature. In reference to the housing, it really is a very robust area that we are trying to help provide services that include everything from asthma remediation to home remediation to pest remediation to providing things such as air conditioners, humidifiers, again, pots and pans. And what this really dovetails off of is the eligible members that we are seeking to help. Now, when we say eligible members, we're talking about certain categories of Medicaid members. They consist of children under the age of 18 that have chronic diseases, children who are transitioning out of foster care, children currently in foster care, children that are involved with the criminal justice involvement, spousal abuse, as well as pregnant persons and 12 months of postpartum, and individuals that had recently been incarcerated up to 90 days or coming out of transitional housing or rehabilitation. This is just a brief overview of some of the members that are eligible to receive these heightened or enhanced services, whereas it really does go down a gambit of other availabilities. People that suffer from mental illness, people that are involved with drug addictions, alcohol abuse, people that have disabilities. So again, just a very quick overview. And in regards to the housing, it also does allow for assistance of making back rent up to 6 months if someone needs assistance in trying to find housing, as well as down payments and utilities for housing. In the transportation arm, this is actually serves a couple different things. Not only public transportation or assistance to get the patients to medical appointments, but also for non-medical transportation needs. As mentioned, perhaps somebody needs to go talk to a housing agent or needs to go look at houses, or someone is receiving food boxes, but they don't have the capacity or the ability to get to that assigned location, whether it's a food hub or pantry service or something of that nature. They can take a car service free of charge to them. Okay. Now, how does this work? Again, we are working with organizations that are embedded in the community and healthcare providers. This does include FQHCs, as well as many of clinics and counseling session or counseling therapeutic facilities throughout the city. What we want to do is increase the number of agencies that we're working with to be able to meet the needs of the individuals that we are encountering through a service referral platform. That service referral platform is Unitas. This is our closed loop system. The thing that makes the waiver really, I don't want to say, helpful or a godsend to the organizations we're working with, because they have been doing the work for a number of years. Through the waiver and partnering with us through our SCN, these organizations are now capable of receiving some reimbursement for the time they spend in doing the screening and the navigation, and obviously the referral delivery, care delivery. In regards to the different types of payments, there is a fee schedule that has been established by the state, so we adhere to that. By the number of units or the amount of time that an individual spends, speaking with a member, is how they get allocated funds back for that time spent. Of course, there is a cap for any one screening, which they can do on an annual basis unless there is a major life change. And that major life change could be anything from loss of job to moving to pregnancy or some other factor that is considered a major life event. And in which case, then we can rescreen them again to see what needs they are eligible for. The nice part about this is it's everybody in the household that is Medicaid eligible. So if it's children, if it happens to be as we know in New York City, there are many multi-generational family households. So if there's another member in the household that is also a Medicaid member, they too can be screened to see what services they would be eligible for. So the whole process begins through the screening, through the navigation. If it is discovered that the individual is eligible for the enhanced services, then we do another screening utilizing a screening tool that the state has asked us to use so that we can identify what services these individuals are eligible to receive. And then from that point, they're moved over to the care management side. And much like what Julia was referencing on the time frame, we have 5 days to get that individual into the referral for the referral to be accepted. And then there's a time frame from when that referral, once accepted, that the service is delivered to the individual, and that's 7 days. It is our hope that, you know, by building out the infrastructure of our partners, that we'll be able to meet the needs of each of the individuals that we're screening. To do this, we also allow for our CBO partners to be able to receive capacity building money. So what the capacity building money is really the heart of the money that the state has given to us to dole out to the organizations that work with us in the SEN. So utilizing a calculator that has been created and provided to our partners, once they have executed their contract, they receive the calculator and a form for them to fill out to see how much money they can ask to receive to help them be successful in the work that we're asking them to do. And so it really comes down to a couple of different things. Number one, finding out how much it's going to take for you to be able to do the work that you want to do. And of course, we know a lot of times that is manpower. So building up the staff to be able to do that. The secondary component might be space, having the space to be able to house the staff to do the work that we want to do, such as the screening and navigation. And then once that's sort of identified, how many staff you believe you will need to be able to do X number of screenings or X number of service provisions throughout the year, based also upon what you need as an organization for your, you know, sort of your cost to keep the organization afloat. So if you hire 10 new people, then obviously you need to have income for those 10 people. Plus you need to figure out all the space needs, paper, equipment, things of that nature. So we know that organizations will have a built-in cost that they need to be able to meet for them not to go, you know, into the red. And so the calculator will go ahead and say, okay, you say you're going to do, you're going to be able to do this number of volume per year, and this is how many staff you want, and this is what your percentage is. It will then calculate as to whether or not the amount of money that you're requesting for the capacity building dollars is right on target, or if it's too low, or if it's too high. And if it's too high, then, you know, it's just a matter of going back in and justifying, okay, maybe I can't hire as many people, or maybe I need to have more clients that I see for the referral process. So once this is all done, we are bound by the state to give the money to the partners to be able to implement their project or their participation in the SCN. Okay, I'm going to stop right there and see if anybody has any questions at this point.
Excuse me.
Yes.
Um,
Carlos, filling out capacity, with the, CBOs you're working with locally. My question is, given what's happening with the potential of Medicaid cuts being proposed, how will you be able to continue the work that you're doing with these organizations?
Excellent question. So, yes, let's call it what it is. They're trying everything that they can to claw back as much money as they can. The nice part about our program is that a couple different things. First and foremost, our money is not tied to any of the quote unquote things that they see as let's just say an affront to their base that wants to have those things taken away. We're not doing anything with reproductive health. We're not doing anything with gender identity. We're not doing anything to that end. What we are doing is we are helping. And if it is a child or a youth that needs to have counseling for because they identify as LGBTQ plus and they need mental health counseling, we can do that without damaging the funds or being concerned with that being pulled back. Everything that we are offering directly reflects the needs of members that is very simple: housing, food, and transportation for medical appointments and non-medical appointments. There's nothing in it that is in opposition to this administration. But more importantly, the money that we have has already been sort of line item and put aside. So as long as we're doing our part in doling out the money and for these capacity funds, because we can't sit on it, then we will get the next payment, which is for year 2. So we're paid on a year by year basis. We are funded until March of 2027. And I place no hopes, just being really honest. At this point, the administration is just too stupid to see the value in what we're trying to do to help the public. And unfortunately, this country does not recognize the chief resource that it has, which is the people. So therefore, no, I don't see this being funded again beyond 2027. I do see it being very successful if we're capable to do what we want to do in helping people to receive these services. And cutting to the reality of the matter here too is that this is across the country, and these members that might have thought that Trump was going to do them good and do everything like that, once they see that if he starts affecting their costs of insurance, their costs for services, the things that they need, then there's going to be a different story. Now, do I expect the Republican, and I'm sorry, I don't mean to go on a political diatribe here, but if we expect the Republicans to grow a spine, probably not going to happen immediately, but every elected official wants to be reelected. And if there's enough people that come out and say, hey, don't mess with, what I'm getting, the services that I'm getting, or my mother is getting, or my husband is getting, or my child is getting, I guarantee you they're going to take a standoff approach. Okay.
I think that's beginning.
I was gonna say from your mouth to God's ears. I hope that is the case.
I think it's beginning to happen, and from what I've heard from a number of commentators and actual organizers and participants, the number is bound to grow and increase. So we don't know what Dr. Oz is going to suggest, but whatever it is, it was already in the Project 2025 plan, whatever it is he suggests.
Right.
So, which means cutting. But it seems that as long as there's a lot of pushback from people, we the people, perhaps it could have somewhat of an effect. But as Monique just referenced, from your ears to God's ears. But having said that, what is happening from the standpoint of those that don't have immigrant status? Many of
Mm-hmm.
them may be afraid to come out, register, and check. And they must be helped. They'll get sick, God forbid, but they'll have certain crises, health crises that will happen. How do you think you can handle that? Because you feel you're not dealing with the LGBT concern or reproductive health concern, but that's kind of strange because I know there's going to be some need somewhere for that as well.
Yeah, and again, full transparency. There are there is um, a sector of Medicaid members that will not be eligible for the enhanced services. It does not mean that they are not eligible for any other type of federal or local services that are provided, but they just won't be eligible for the enhanced service portion of it. And unfortunately, um, anyone that is currently receiving emergency Medicaid, like non-documented individuals, they are not eligible for the enhanced services. So, my biggest concern, from a not only a public health standpoint, but as a humanitarian standpoint, is that we need to ensure that everyone has access to health care so that way they don't run the risk of endangering themselves, their family, their loved ones, or anyone else just by sheer proximity. No one lives in a bubble in this city. The only bubble is the subway. And I try to get out of that without getting sick during the peak, uh, respiratory disease time. And so with that said, thank God there are still agencies and there are still resources available to help those individuals. So, PHS still continues to do work with clients that require assistance for insurance, SNAP, Medicaid, emergency Medicaid, helping those that are new immigrants or undocumented. PHS continues to do that. It's another division of our organization, but it's not as though that is going away. And I for those of us who lived through the Trump's administration, first go around, we know that many grants were cut, money was clawed back, and a lot of really good people, both that were doing the work to help ensure their neighbors' health and providing food, all sorts of services, lost their job. And at this point, it continues. But the one thing which I am hopeful and believe that even though there are no real guardrails in place to prohibit this administration from doing what it wants, there is enough clamor from people that are willing to say, no, don't touch this. This is mine. Don't, I put you in power. Don't touch it. And so I think that is the saving grace that we have is the voter.
Yeah, right. Well, I think that's, like you said, they have funding until 2027 for sure. So you will continue doing your best work.
And I
That's all we can do.
And I think Carlos conveyed that I've spoken with Broadway Housing, Yael,
right,
Sanchez, and both. I needed to bring it before our committee this evening, and indicate that we're interested in co-sponsoring. We may have to change the date, but I think April 16th is down, but I haven't talked to Carlos, but we might have to see, and I'll see with the IL if maybe we can still do the 16th, but my preference would be the 23rd. And I think that gives us enough time to promote it and have as many people in the district be involved as possible so they can learn and know what they need to do. What is your capacity in terms of enrollees? What do you think it is?
For
Capacity.
taking on new organizations?
Yes, well, or the organization. I don't know if that's by
So I can
people
be
or
real
if we
honest.
have enough. I'm by.
No, I can tell you honestly, right now we have approximately we just launched with 120 organizations. We have another 100 plus that are waiting to go live with us as well. They just need to go through the processes of onboarding, get the training and certifications. And then, we by the state's, promotion, they have we're doing an ongoing solicitation for anyone who wants to join our SCN. Again, the key component here is that we know that if we screen 2.6 million people, we are going to discover that there are a lot of unmet needs that people just did not realize that they were eligible to receive some sort of service for. The number of people that need to have, transportation assistance in and of itself is crazy. The number of people that suffer from either some sort of pest issue or asthma issue in their dwelling is truly astronomical. But for many people, they don't think that they have the ability to do anything about it. And so consequently, if we find that there is a need and we can help provide a service, then that in itself is a game changer for the health of that individual and that family. Conversely, same thing that goes as Julie was mentioning earlier, being able to provide services for individuals that need to have some sort of mental health therapy or some sort of assistance is in and of itself will be a radical change for someone's life. So we don't think that we're pretty positive we don't have enough organizations on hand to be able to fit the needs. So we are constantly reaching out to other organizations. We love the opportunity that you have provided for us to be able to share our SCN to this committee, because the more that we can trumpet it, the more we can start to bring more organizations in and we can start to help more people.
What is your cutoff? Is there a cutoff for enrolling?
We don't have
I
one.
know
We don't have a
you're
cutoff.
still working with. Okay.
Yeah, I mean,
Okay.
no, it's, the funny part is I jokingly say when I joined, over the 25 years I've been in public health, it's the only career that if I do my job really well, I'll work myself out of a job. And unfortunately, there's just always a need. And so consequently, I continue to work, which is a good thing. I'm far too young to retire.
Yeah. Yeah. Well, if I know that there was a tremendous problem with Carlos's presentation, but Carlos, if we can, I don't know if you hear, because it was difficult for him to hear us too, because we kept calling his name. But Carlos, if you can hear me, let's try to talk tomorrow. So and with the IL and perhaps with our West Harlem Development Corporation grantees, that's 12 organizations. Maybe 10 of them will be available to participate and get, help bring people, or I'm not sure what's really needed. If it's organizations that we need to try to pull together, or people, or combination. And that will make a big difference in the location we select. If it's just
As yeah,
organizations, then
now as the saying goes, it
we
takes a
have.
village. You know, we need to have organizations that are able to in whatever capacity they want to. If they want to put boots on the ground to go into the community to help you know, promote and raise awareness, great. If they are want to just take the people that we are funneling to them, great. Carlos, my team, and our Brooklyn our associate who's overseeing the Brooklyn you know, project of side of this project, we're out in the community, and our focus is just to raise awareness and help, you know, funnel, for lack of a better way to put it, you know, individuals that we meet to our partners, because again, it's an opportunity for them to do good. It's an opportunity for them to bill for the service they provided, and you know, and that's just the bottom line.
And what happens after 2027? They just lose the Medicaid at that point?
No, they
Or do
so
they continue with the organizations, and the organizations continue to try to find other Medicaid monies to support those that are enrolled?
well, so what happens after that is, you know, the truth of the matter there is that we want to try and, you know, okay, so the big thing that everybody wants to talk about is sustainability. How do you sustain the program once the money's been taken away? How do you empower a community to be able to continue to build on the successes they have? How are you able to help organizations to retain staff? You know, that's God only knows, as my mom would say. The one thing which I can tell you is we want to improve lives now. And if we're capable of doing that, hopefully we'll be able to help those individuals to change the trajectory of their own health demise. And that's, you know, that's what it comes down to. Um, I hope and pray, honestly, that there will be another round of funding that will help our partner organizations to be able to do the work that they have been doing post this grant. Um, but you know, you know, I can't say, but I can say that while we have the capacity and the capability of bringing these services to these individuals, we're going to do it. You know,
Good for you. And we have a resolution, our committee this evening, related to opposition to these federal health budget cuts. I know it's not the state, your state, but, so let us know if there's something,
oh,
as
it's
time
federal.
goes on, there's, okay. Let us
Yeah,
know
it's
if there's
federal. The federal government doled it out to the state, and the state doled it out to nine entities, you know, social care lead entities in throughout the state. In the Bronx, it's Somos, and Staten Island, it's SIP Staten Island's partnership, prevention partnership, something I can't remember. I apologize. Don't tell them.
Oh, no, thank you for clarifying that. At any rate, let us know down the road if there's something we can do in the form of a resolution that could help. And we could also try to involve other community boards, particularly in our close to our district. But we have a resolution that we hope will pass this evening that has been emailed to all our committee members, and it'll go to executive and then to general board, opposing all of the federal health cuts. You know,
Okay.
we're a district, but you know, it's the districts that make up so much of what happens on the federal level, so they need to pay attention to us. The letter, our resolution, will be going to definitely Congressman Espaillat. Let's see, at least one or two of them this evening. We have three altogether. Well, we have a letter of support.
Okay,
Uh,
excellent. Well, I know Carlos will follow up with you, and again, I do thank you for your time, and I thank you for this opportunity, and I'm sorry that I went so long-winded.
Actually, you're right on time now, and hopefully I don't see any hands, but are there any other comments or, statements from anyone? So, we appreciate, Michael, your, presentation, and we appreciate so very much Carlos's outreach, and we've been on the phone working with him and talking with him. And so just hopefully he can hear us and he'll get back in touch, tomorrow preferably, so, because it's a lot of planning.
Yeah, I'll make sure to circle back with you tomorrow midday.
That sounds good. Okay, thank you both so very much, and, we're able now to move on to the very next thing, which will be our resolutions.
Okay.
Thank you, everyone, for participating, and I know Katrina has her, letter of support that needs to be discussed, but, we'll move
Okay.
now to,
Thank you.
talk about, thank you. Wait. Let's see, Carlos and Mike, are you still there? Oh. Okay, they left real fast. Oh no, it's not them. It was, Nicole. I don't think she's still on either. Okay. All right.
I'm here.
So resolutions. Oh, Nicole, is it possible for you to email your, attendance sheet tonight? Complete just the top portion, and then I can sign it that you presented the attendance sheet and then get it back to you tonight? I mean,
Oh,
it's
sure. Of
within
course. I
30
can send it over. Yep,
Okay.
no problem.
Okay. Okay, thank you.
You.
Let's see, do you have, I'm trying to think. I think I first learned of you through Youtha Prince. You have Youtha's email? Or if you
I
send
do
to
have
me,
it. Yes, I have it.
Okay, can you attach it to her? I believe it's Youtha who's still, I don't think Hakil's still here.
Okay.
And then we can get it and I can sign it and get it back. Thank you, because I know you
Thank
guys
you.
need it, in a few days.
Yes, thank you so
Okay.
much.
All right. Okay, resolutions, let me see if one of the first resolutions, came from, came regarding the MTA. Let me just find it. And I was able to present to, the concern to Uniform Services and Transportation, and actually Edwin was here on CB9 Connects, and some of you are on it and some not. An issue came up from Monica, and Monica was here, I'm not sure she still is here. And one other person, I know I've had the issue as well, related to the removal of benches, in the subway. And,
In our station says that, I haven't seen the,
not,
least
oh,
far,
in a number of the MTA stations.
when
where
in our district, has it happened?
I think, I've seen leaning bars. I've seen some leaning bars, because I'm in so many different, stations.
No, I'm saying
but
in our CB.
in RCB, I believe I've seen a leaning bar even at 125th. But they are happening, and I think we need to nip it in the bud,
No, I
even if
understand. I agree.
I can't say
I think
which stations, but I'm in so many CB9. Edwin,
I haven't seen
what I was just gonna
CB9,
say,
so.
it may not be, but we need
To
I
prevent it,
think.
yeah.
And then, I just want to add before, and we're open to discussion, of course. But I just want to add that it was well received at Uniform Services, because so many people have seen them.
Yeah.
And there's so many, whether you're elderly, handicapped, pregnant, tired,
Exactly.
recent surgery, whatever. I think Monica's might have been in CB9, but anyway, people are just, they feel it's awful, and those benches should be restored.
Mhm.
And we don't have to necessarily wait for it to get to our district, but it's good if we can name perhaps, or maybe not get into that, just don't remove them. Anyway, the main thing is that they wanted us to add an addition, and I had talked to Solomon yesterday, briefly. They wanted to add something related to the bus coming even closer to the curb. The buses are stopping in the street, but that has a lot to do with one of our other resolutions where we've said there's so much double parking and all of that, that the buses can't even get to the curb in a lot of instances. And some of the drivers complain. But anyway, that was one thing. And then there was one other, I mentioned also, again, benches even on the outside. There's some places where there's no shelter and no benches at all. Like at 145th and St. Nicholas. On the downtown side, that's a very busy intersection. And on that one, well, I don't think actually there are any benches and no shelter.
Yeah.
That's the main interest. Anyway, we have a number of them like that. So I'm sorry, Edwin, I just wanted to finish up what happened at Uniform Services. And I'm gonna see if I can. Edwin?
Yeah, Monica is I'm sorry,
Edwin?
Laquita. It's like Monica said in the group. I think Monica she had a personal experience with an issue in one of our platforms, and that's where this came about, where it was brought up that these benches are being removed, and we have our seniors. You can think of an array of problems. Pregnant, you might not just feel well, and leaning against these benches might not be the most best position for you. I think that the MTA, they have to get their engineers to work, because we understand what they're trying to do is deter some of the homeless folks from sitting there, but we cannot have that at the cost of one of our seniors falling because they became dizzy and they didn't find a place to sit.
Yeah, I agree.
Right. So that's the first one. I mailed 3 of them. Last night, I think I was waiting for Solomon. I don't see, oh, wait a minute, here's Solomon's edition. Here, please feel free to move forward. Maybe you can include the link that he provided as a reference within the resolution. Wait a minute, Felipe. Okay, Felipe, wrote something. The resolution as written is pretty narrow with respect to condemning the removal of benches from subway stations. My idea was to add language that describes how to make public transit options more attractive and accessible to all. That might be too, I think we need to deal with the immediate. Sometimes the resolutions have to be that way for action, but we could perhaps, I wanted them to just go ahead and write it. As a side note, looks like the DOT and the MTA had the West 145th Street corridor as a target for improvement in 2017, but 8 years later, nothing has been done. Yeah, we've been talking about that. Felipe's kind of new, his first year, but we've always talked about how they have not fulfilled the promises of 2017.
Laquita, it's a great opportunity if Felipe wants to bring that up as a reso to address that issue also. I don't know how you guys feel.
He could do a separate one through UST, and we just keep moving on this because we're close to the end of the fiscal year. Let's see. He's included something, so I'll ask him. I'll talk to him. And Solomon.
Okay.
Because Solomon forwarded Felipe's suggestion, but you're right. I think and now he did it late, so let's see what's happened here. Actually, he did add, but where did he add it? If anyone else wants to talk while I try to find Solomon's change.
I know I sent in some minor edits. I don't know if it was to that reso, because there were 3. So.
Yeah, there were 3.
No, there were 3. I commented, I think maybe on one. I'm trying to remember. I can look and see what I sent. But I thought it was a good, reso in terms of addressing that issue
Absolutely.
and
Yeah.
making sure that we get what we need and yeah, if we could get more things for a shelter, that would be nice though to have a
Yeah,
nice.
seniors, the ones that are fortunate enough who can get around, standing out there in the rain or running close to a building so they can
Right.
get shelter if that building has an overhang, you
Yeah,
know?
exactly. I know,
There's so much in our community,
yeah,
but yeah.
we need a lot. Let's see if I can.
So, to be honest with you, I have this from Solomon, and it's not much of a change, but I'll look for whatever, they did something. And, if we can go ahead with it, approval as it is between now and Wednesday, actually between now, today is Monday, between now and Wednesday, because we have to submit our resos and all on Wednesday for the for executive committee. I can find whatever it is. And by the way, if anyone is commenting, do it in a color highlighted. That way I'll know what your specific, recommendations are. And that will help. And here with, Solomon, Felipe forgot to do it.
All right, I know the comments I made was for that particular reso, and they're highlighted in yellow. I'm looking at what I sent back.
Uh-huh.
Like I said, they were minor.
And he did a draft of a resolution.
And then there was.
And I'll try to match up where his recommendations are. And, and just, we know what they wanted to add. But the other main thing about having this resolution approved as soon as possible, and nothing happens very quickly with us because a week before community board, the general board is, first has to go through committee, then executive, and then general. So that's 3 weeks or more right there. So, and also where they have begun to remove benches, they may not have torn them up, broken them down. So we need to be able to say, restore them right away. They would have to make the ones for outside, but I'm not sure for budget reasons if how much money will be needed, but then there's the budget consideration to it. I'm not sure if we're too late for that, but they, let's just get it going so that if I can have a motion to accept the resolution, hopefully everyone does. Could I hear a motion?
Did everybody?
Michael, and Liz, you know what? I didn't see you come in, Liz Eastman, and you've been here. Where is she?
I don't know.
Is she got her headset on?
Yeah.
Okay, so Liz or Michael or Heather, someone move.
Laquita,
Yes, hey, there's Monica. Okay, Monica?
I move that we accept all the resolutions on unanimous consent.
Oh, all of them, has everyone had a chance to, well, let's at least highlight them if we haven't, let's at least highlight them, okay?
I would say unanimous consent of taking into consideration any minor edits.
Yeah,
Okay,
edits are fine, but
right. Yes, I did make a reference to one of the resos. I want to always thank Edwin. We can talk about something and something comes up and we can always depend on Edwin to okay, he'll say you drafted or something and I'll polish it, or else he'll just take it. Okay, I want to present this And one of them, he did send diabetes and he made a presentation to our group once. And they're talking about taking away and very, very important funding. Edward, can you just give us a couple of sentences on the diabetes reso? It's a lot.
Yeah, so the reso is pretty extensive.
his
We
main
put all
area.
the
Okay.
supporting
Wait a minute.
evidence of the past 30 years and what has been done in diabetes prevention program. Basically, this was a study that is conducted in our communities, and we don't have to tell anyone that cardiovascular disease and diabetes are, the number one killers in our community. And what happens is that the administration, they withdrew all the funding. You have centers like Columbia, Montefiore, and you see that these are places that they treat a lot of folks of color, and we need to understand more. So in the past 30 years, a lot of research has come out of that has been able to help us providers provide better care to our patients. And I think that it is very vital that we continue to do this work. I'm not directly involved with the DPP. I am, a diabetologist. So I know a lot about the program and know some people involved. But I think it's quite cruel to have the people in the community just being stopped from attending this program and for us to learn from that program. So it's a long reso with all the supporting evidence there.
And that's his forte.
Yeah, it was pretty
Thank you so
straightforward.
much, Edwin. Okay, so that's the second one, and that third one was one I mentioned in reference to, and we need to have a whole slew of them on federally cut back on federally funded programs, because they affect us down to the district. So
Right.
can I, so at least we know something about it, those,
The federal workers.
some will go to Congressman Espaillat. We'll see who gets, but all of our legislators ultimately get the resolutions, and it gives them something to fight with, to indicate what their districts are saying and what they're feeling very passionate about. Okay, so now for the, are you ready to vote, committee?
I thought Monica made a motion.
Yeah, but we needed to say, so now Monica has moved that we accept all the resolutions by unanimous consent with the revision, or not revision, the addition of, if we see something between now and particularly Thursday, let me know. We could always modify in some way if it's significant. All those in favor?
Well, I was gonna say, I second Monica's motion and.
Oh, that's right. If we got a second, it's unanimous consent, then are there any objections?
No, but just a comment.
Uh-huh.
Oh, yes.
Speak up though, Michael.
Sorry, the comment about the seating, the chairs that were removed.
That's with the MTA?
Yeah, I think our committee on the Uniform Transportation Committee.
Yeah, that's a joint one.
Or say, probably by email. So.
They already voted to approve it at their meeting Thursday night, the resolution, because we had it ready. And so it was presented at their committee, and they just wanted to add this little piece.
Yeah.
So are you saying separate it out?
No, I'm not saying separate it out, but just be aware, just in case people wanna chime in. Because it doesn't seem like there's,
Yeah, they have, just that they haven't given me they were supposed to give me the exact, they literally voted on it. It was by unanimous consent Thursday. And they met before we did because of the way the calendar falls. But this resolution.
It should be in their minutes, Laquita.
And it's in their, it's in their meeting, their minutes. Michael, it's in their minutes as well from Thursday.
yeah.
It was overwhelmingly received.
That's bothering you that you want to.
Oh, Heather was there too.
Necessarily, but I was just letting you know that perhaps people are gonna wanna add or subtract to it.
Oh, yeah, they can, and Solomon and Well, not Felipe. Solomon would be at the executive committee on Thursday too, but I'll share it with him before. I just gotta insert, the way he printed it, I wanted him to just come up with the one paragraph. They spoke about what they wanted, but I wanted them to write it. Yeah, I wanted them to write that whereas, therefore. And so, he said that, and I reminded him yesterday about it. Cause they had said Thursday, but that's, well, Heather, you were there too.
Yeah.
Yeah, it was totally, that's right. Yeah, it was, unanimously, accepted. But you're right, Michael. I'll word it some kind of way and get it to, Solomon so that we don't lose any more time and it can be there on Thursday, Wednesday be emailed out.
Okay, I only said it because Felipe is in an email chain. I didn't know if he was trying to change it. So,
Yeah, he wanted to talk about total upgrading, and aesthetics, which I agreed to. But I think now we should just deal with this one that was voted on, and we could always add, do it. They could put together another reso. It would be nice actually for that one, since it kind of deals with health, but it's really more UST. This one has a lot of public health aspects to it, the benches.
And I just want to add that if, we just make sure that we're calling out Manhattan Community Board 9 instead of just saying Community Board 9.
Okay.
Because there's Community Board 9s in other boroughs.
Right. Generally we do, but I'm glad you pointed that out. I think it's, yeah, good point. Mm-hmm. Okay, anything else? Okay, so, the reso moves forward and taking into account what Michael and Heather have added, I'll tomorrow try to get this to, Solomon also. Yes, now we move to the letter of support that Heritage is asking for. And let's see, we're doing so far not too bad time wise, but let's spend about Patriana, where is she? Patriana. I may not have said it right. To correct me, the pronunciation of your name, as well as I know you. It's a beautiful name. I don't want to mispronounce it. Is she there? Yeah, she may have stepped away. I see her picture up there.
Yes, I'm here. Do you guys need me?
Yes, I need you to talk about your letter of support that you drafted for us. We definitely know Heritage Health and Housing, and of course, this evening, in the discussion on mental health, Edwin brought up, the resource that Heritage provides in the area of mental health as well. We also have, of course, the Emma Bowen Center. I'm not sure if anyone's online right now, for that. Where did I see CJ? Anyway, but I'm not sure if he's actually still there. But anyway, we do have, they have been, constant. And let me say hi to Dr. Yana. Thank you for being here, Yana. At any rate, I need you to talk, even though we know Heritage, tell us what you're doing now. And were you able to get an extension so that we could, so that you could draft a letter and, see if we can get it, voted on at the community board?
Sure. So I am working on the 1649 construction project of Heritage. Let me just turn my camera on for 1 second.
1649 Amsterdam Avenue, and just as a reminder, because of what's going on at 1727 Amsterdam Avenue, where the city, Heritage, no, New York City Health and Hospitals Corporation, has made some moves that have forced the
I'm still here, guys.
Heritage
If you need
to
me, let me know.
utilize its other facility that it wholly owns. Okay, and that facility is located at 1649 Amsterdam. Okay. First of all, Petriana, I asked you to pronounce your name, so I wouldn't keep mispronouncing it.
No, it's okay. It's Patriana.
Petriana. Okay, go ahead, Petriana.
So I am working on a few grants to do the construction of 1649 Amsterdam Avenue. As you all know, like you said, Laquita, they're moving their facility from 1727 to 1649. And I've been doing some active grant writing for the organization. So right now we're working on an application to Congressman Espaillat, and that is for the community funding projects. And that is a project, actually, we applied last year. However, the Republicans had changed some of the qualifications. So now we're reapplying for the housing specifically. And we did apply for the Senate appropriations with Schumer and Gillibrand that was due on the 4th. So we already submitted those for the health center, but now we're working on the application for Espaillat for the housing. So I know when I spoke to Ms. Prince, she told me to speak to the health committee and the housing committee. So the letter of support that you have is specifically for the housing, but I can redraft another one just specifically for the health center. It would be good if we had one for each one, because when applying for applications, sometimes people don't want to fund the health center. Some people don't want to fund housing. They want to just do the construction of the health. Sometimes they want to do construction for the housing. So having two separate letters would be very, very beneficial for us. So that's what we're working on now. Huh?
Well, our executive committee meets on Thursday. With my committee, we've been able to, this is not a long letter, we've been able to, over the phone in a couple of days, give people an opportunity to read, and then we do, they respond back by email. But we're all here now. If you want to add in, it doesn't hurt to keep what your overall goal is with the housing. And then add the 1 or 2 paragraphs related to health. That's going to be important, but you have so much that's written now. If you can do it and get it to us, tomorrow evening, do you guys think if we get it tomorrow evening, I could email to you and we, because I know how.
If I can just interject, can you hear me?
Find out you need a letter of support.
Can I just
Go ahead.
interject? So the reason why we're specifying for Espaillat just the housing is because last year, the Republicans, which were the majority in the House last year, they took out any indication of health center. So we want to increase our chances of getting the funding. So we just want to stick to the housing piece for Espaillat. However, again, I can send you another letter of support just for the health center, and then we can rework it for that one, and then just, again, have 2 separate ones. But for this application that's due on the 18th, it needs to specifically be just for housing, because they made it very specific that ineligible projects, health center is one ineligible project. And being that 1649 is doing 2 projects, the housing and the health center, we just want to focus on the housing. However, again, Ms. Prince had suggested I come to both since Heritage is health and housing. So she wanted me to come and speak to you as health center, as health committee, as well as the housing for tomorrow. So I'll be on tomorrow as well.
Okay. So
I can rework the letter of support for the health committee for sure.
Right, but right now we just need to look at this, make edits where we want, and just deal with housing. Because it would be signed by our chair. Okay, okay. So have you had time to read it? Do you need more time, committee? And do it? Okay. What is your disposition? letters of related to parents.
Can the people online see it as well?
It'd probably be with the,
It's really only the committee that needs to vote on it.
Oh, okay,
That's
well,
right. And
wait.
see the ones online.
Oh, there's nobody-
Oh, wait a minute. Well, we do have our public, let's see, Monica
but
and Ed
only us, I guess the committee members vote,
don't
right?
vote, yeah.
Right, I
those
mean,
don't
I
vote.
think to me, the letter is pretty straightforward in
Mhm.
terms of what it needs to, what it
So
wants to address, so.
Uh-huh.
I-
Any other, are you ready to vote?
yeah.
You have is there a question?
Yeah, just a comment. I think this letter could be a little longer.
Mhm.
It could maybe be like page long. I don't know how it could be formatted.
What kind of information do you think she should add, Michael?
Like,
See, we don't know the proposal, what they're asking for.
Maybe there's a restriction.
Are there Michael has stated that he felt you could add a little bit more about the, housing component. Doesn't have to be 2 pages, but a couple more paragraphs, but we don't know what the, proposal is asking for.
Right, do you have a word limit or something in
Is there-
terms of the
yeah.
letter?
I'm sorry, can you repeat that, Monique?
Is there a word limit in terms of how long the letter of support has to be? Or
No,
can be?
no, there's no length of words. They wanted us to combine all of the letters of support. They wanted it to specifically be from somebody from the public sector, either a council person, community board, so forth and so on.
Got it.
But there's no qualifications on the length of it or anything like that.
Because one of our committee members suggested maybe you could add a little bit more language, I guess to enhance it.
Mm-hmm. I'm trying to,
Michael,
Some
did you?
background information,
Yeah.
like why you were displaced, where you came from,
yeah, maybe the population served.
said in a letter that I wrote regarding this project, when this project came before the Landmarks Committee.
Mm-hmm.
So there's a letter I can pull out that could add a little more. Basis to.
Yeah. And I think that because it'll be coming from us. And I may not be able to work on it till tomorrow, but at least it'll be there. Yeah. And I'll get it to everybody.
Okay. Why you're displaced and then what do they need?
Mm-hmm.
So I have that.
Is there any, Heather, I'm not sure if you heard what Heather said, but she has a letter that, our chair signed when you came before the,
To the Landmarks Preservation Committee for a letter of support before you went to Landmarks, we wrote a letter regarding just the housing portion of it. And so I have that. I can share it with you and with the team members to give some additional background information that might be helpful to you.
Okay, that sounds great. Whatever's gonna make the letter of support more abundant and appeasing to Congress to get the funding for the project, it would be appreciated.
Do we have your email or do you want to put your email in the chat or?
My email, sure, I'll put my email in the chat.
If Rita has it, that's fine.
I have it. And then we won't do a whole lot of back and forth because it get confusing. Once you send me.
Because a lot of it is in here, some of it is in here, but I.
Yeah, it doesn't have, it needs a little bit more. There's also, let's see, we've done other letters, approved letters that, say a little bit more about heritage, health and housing, a paragraph.
Because it's a landmark structure, that's another good reason why additional funds are necessary.
That's a
because
good
it's
point,
more
landmarking.
because of that designation, things cost more.
It's that building,
To preserve.
right, okay.
Yeah,
So you want to bring out issues like that in. the-
great point,
Okay.
great
We
point.
had a big discussion around that.
Uh-huh, and then maybe we'll take, a paragraph from one of the other letters done in support of heritage that is, stronger, giving some background as to why they're an important organization in our community.
Of the community.
Yeah,
That's true.
okay, let me add that in up here, which means that we vote on it after, hopefully I can get this to you tomorrow night, or do you want
Tomorrow's
to?
Tuesday.
Tuesday, yeah, we have to,
Right,
because
because
they're
we're
gonna
gonna get
need
it to
it
you, so you have to include in the packet.
Wednesday, right.
Yeah.
So, but at least it's already approved wording. It's not. Okay, so I'll do the about heritage. And it will be, because Victor, has to be comfortable coming from us and it'll be him anyway. And then we'll add the landmarks. I'll put Heather in landmarks. And I know you guys are real busy during the day, but I'm gonna try to get it out, at least by midday tomorrow on my lunch. I have a work schedule, but at least by like my lunch hour before 2 o'clock. Or even if you got it by 5 o'clock, that should work also, right?
Yeah.
Okay. Okay. And then, okay, so Petriana, just check your email tomorrow, between 5 and 8. Okay. All right, and then we can vote on it. I'll get everybody's feedback. Actually, you could just, once it's put together, you can just say, sounds fine, or indicate a suggestion that you'd like to make. By, what, Tuesday night, Wednesday morning? What? I would say, let's see, I would say Tuesday night, but don't hesitate if it's Wednesday morning. We have, 6 committee members. 1, 2, 3, 5 are here. Thank God. Thank you guys. I tell you, 5 are here. So, as long as, you guys, approve, we can, move forward. It's not a long letter. We're just talking about adding what sounds like maybe 3 paragraphs.
Okay, yeah.
Okay,
I have the letter. I have.
you found it? Okay. All right, Petrona, so we'll get back to you on the vote. I feel positive because you guys are so critical to our community.
Thank you so
And,
much.
we know so much about what's going on already, so it's just a
Yeah,
matter of making the letter strong, because we can't assume how much Congressman Espaillat knows, even though it's his district, he knows something, but he may not be up on some of the details, so, and
right,
whoever reads it in his office, has to feel comfortable
right. So
as
I
well.
did ask Nina and Monica as well as Joseph in reference to anything that they needed. So I have a direct line to them, and I actually presented this project to them back in 2024 for 2025. And at that time, the parameters were different than they are now. And it was a project that they were very excited about until they voted down certain particulars within the community funding project. So now we're bringing it back, not with the health center again, with just the housing. So
I understand those changes, but there was something sent out where, the the legislators were almost about to lose some of their funding for community project, block grants. They're called block grants. So they all, some of it got restored, and I think that's what this is showing. So I think that's an additional reason for having to have a very strong letter. Okay,
absolutely. Thank you so much. I'm gonna put myself on mute. If you need me, I'm here.
now let's see, so we've covered, all the resolutions and letters of support, but we'll vote on the letter of support after we see it, in its final state. Thank you, Michael and Heather, for both of your suggestions, and Monique always for yours, and Miss Liz, I'm so glad to see you. I'm sorry, I was doing something when you came in, but I'm happy you're here. And I went over there and I put Zoom. And I said, so I have to scratch through that. All right. Any, well, the new business, let me just say real quick with the, public health forum, I'm not and you all may feel differently, I don't think every year we have to do a public health forum. I was hoping for one, but I started feeling differently with all the political shenanigans going on around the budget and all. What I think I would like to suggest, and I think there's an avenue for working on it, is having a couple of presenters speak on what's actually happening. I know Columbia is interested, and when they were here and addressed it, they wanted to wait. I don't know if they wanted us to wait for the 100 days, because we talked about a task force. I recommend a task force that we put together. I think we could still bring a look at our health situation 2025 and how we move forward. I think if we do something like that and combine it with nutrition as medicine, there are two groups that want to, one wants to do a whole food setup on nutritious food and have some sampling. Maybe we can find a location that allows us to do both food as nutrition, food as medicine, or nutrition as medicine. And City Harvest asked today also to come back. If we could combine those two groups and maybe a third and fourth food group, so we could have this like a real nice evening, not here, we'd have to find a location. And then invite like the hospital, not only Columbia, I'll talk to Sandra, but Mount Sinai, Harlem, get those experts in and talk about how we pull it together for our community, because there's going to be a lot of confusion. There's confusion now.
Do you have a date?
I think it's gonna have to move quickly. May, the lady from City Harvest will be back on May 9th. She just contacted me yesterday because she remembered that I'd invited her back. The nutrition group, they wanted it to be, they're also a grantee. And so they wanted to do it, and I could just call them back. I talked to them 3 weeks ago. And I told her I would be back in touch because we had not gotten a date from Columbia.
Right.
But it's okay, we just keep moving, But the location, it could easily be St. Luke's Church, it could be, where do we, there are a number of
In the
groups
community.
in the
Yeah,
community,
make it
out in the
accessible.
community,
Yeah.
which could even be better because we need to make sure people know what's happening. And we need a space for, it'd be great, a couple of hundred. I don't know what boys and girls are doing. They're kind of hard to reach, but they might be. I don't know. I can't vouch for what's happening there.
Right.
Maybe, but they're in the center of things.
I was thinking even City College.
Yes, in City College.
I mean, I don't know, I'm just
City
throwing out.
College, Sophie Davis, they have a new wing. I think that Sophie Davis could be very nice.
Yeah, just to make it accessible. I mean, if the weather is nice enough, maybe we would be.
Oh, they have
outdoors
the
or something,
Spitzer,
plaza or
oh, let
whatever.
me tell you, they have the Spitzer, kind of like an atrium, but it's outdoors.
Oh, yeah.
Oh, now you're talking, Monique. Okay, so yeah, let's.
But out in the community, change it up so that
Yeah,
we're more
switch it
visible
up
and
a
more
bit.
accessible. And like you said, there are a number of organizations we can partner with.
It could be
and-
June, it could be early June.
Yeah.
I'd rather, we need more time, but anyway, well, let's see what dates we can come up with. How you guys feel about that? That's a lot right there. What do you think, Michael? Michael's going,
Well, I mean, I'm not gonna be on the committee board anymore, so I can't.
you told me you weren't sure, but you didn't reapply?
I didn't, and I don't think it's good, right? Because I don't know if I'll be living in the area. I'll be.
But you can come because it'll still be part of this fiscal year, okay? You have an invitation. Yeah, I didn't tell, because you had told me, but I wasn't gonna say anything. I'm gonna miss you too, because you really, stepped up to the plate. But I know you have a promising career and future ahead.
That's
You
right.
got a lot of stuff you are working on, and
That's right.
I wish you all, I'm sure we all do, all the success in the world. But you come back for June. No excuse for that. Okay.
I sent
Okay.
that letter. I just.
Great, Heather, we're moving,
And if I could
okay.
just announce if there's anyone who has any time on Saturday to help table at the Jackie Robinson Band Show on behalf of Community Board 9. We need some more volunteers if possible. Did you sign up? Okay.
What's the time, 12 to 4?
Yeah, from anytime from 11 until 4. Just whoever's gonna be there to set up has to be there at 11. And I'm gonna send out a little sign up spreadsheet to everyone. I'll make sure that you're on there. I'll send it out to, I'll just make sure that it's for executive committee. And then the way I set up is by committee, and then anybody from committee just sign your name in the time slot.
Okay.
So that we just make sure we have coverage, but thank you. So
We
much.
have one of the busiest committees going. Liz, oh, I'm sorry.
The other community boards, we just want to make sure we represent, but it's gonna be 9, 10, and 12.
Okay,
that's good.
Liz, can you help represent? Now, I'll be able to, oh, thank you, Liz.
I'm not even signed up
Let me
already for some time, but I'm gonna.
Will you also sign up for health, as health committee, or you can do both?
It
Sign up
doesn't
as,
matter.
doesn't matter, as long as it's
Yeah,
community board.
Yeah, she's.
I did, I think I said from noon.
Yes, I'm gonna send out the
I said
sign
from
up.
like noon or something.
Right.
Remember which slot.
You said you're gonna resend it,
I'm gonna
Heather?
resend it. I'm gonna resend. the
Okay.
slot for
I'll know by
Thursday.
Thursday.
I'll see if I can,
And see if you have time.
yeah, it won't be, cause I have another commitment earlier in the morning, but I can.
Yeah.
And we
So
just
I-
got-
by
I
later.
was gonna do hour commitments, but then I just changed to half an hour commitments, so that people don't feel, you know.
But once you get there, you
You didn't-
probably end up being more than a half hour anyway.
Yeah, but for, people, I think you had put an hour.
I'm not exactly, because it's a big park,
Yeah.
so I need to know exactly where.
And it can be fun. Once you get there, it's like you fun and all of that.
Jackie Robinson.
Who's gonna make sure of the material?
You
I was
just
supposed to
sent
call
it out.
Cheyenne.
She said that she's gonna have it ready by the end of executive committee Thursday.
What
So
the,
one of us will decide who's gonna actually take I'll ask Walter if he can take the banner to the band show Saturday morning.
I had a note to myself to call Cheyenne for health material, 'cause she's got a bunch of it and she can actually get it to us. And I got busy today and I didn't do it, but it's still time, I still have time.
I'll send out the sign up sheet,
Let's-
so as
let's-
many people I can think of.
I'll know
Is there,
Thursday.
is there like, if it rains, is it still gonna happen?
This afternoon, they sent our contact person, I'm gonna ask them.
Okay.
Yeah.
If there's a rain date, but they could probably.
They have
go inside.
shelter.
They have shelter inside, because it's the rec center right there.
Oh, the rec center, okay, that's good.
Mhm.
Okay, yeah,
But
'cause
I'll ask that question, Walter when he came in, he asked me that question too.
okay.
Okay. All right, so I think that covers it for us.
More to come regarding the public health forum, right?
That was what I just talked about.
Yeah, I'm saying
changing
more to
it up.
come.
Yeah,
Okay.
yeah.
More, in terms of.
I gotta finish, at least the conversations have started.
Okay.
It's a matter of finishing them. And if anyone has any ideas of location, what did we just, City College. I
mentioned
think
City.
City College, but we gotta work on that real fast. And now we have some connections. Well, we had connections before, but we'll just see, because I don't want to pay. I'd like for us to look at who would maybe even sponsor us to be at Sophie Davis. Maybe we'd only have to pay for janitorial.
Right, we can ask Deborah to help us maybe with that.
Well, Deborah, we know she has a location. She has offered it, but that's CB10. And I know we have places in CB9.
Yeah, but she works for City College, and maybe she would be able to connect us and help facilitate that if we needed to do that, but you have your contact too.
No, we can. I didn't think of Deborah because I was thinking of her City CUNY as opposed to, there is a little in their minds, it could be a big difference, but
We could talk.
she does definitely have,
She knows
she can get things done.
Right, she's a resource.
She's a real resource. Okay, all right, so we didn't do too badly, but a little longer, 8:59, because we had a little bit more to discuss, but,
Can I make a
anyway,
motion?
yes,
I make a motion to conclude our meeting at 9 o'clock.
no, it's 8:59. 8:59, every minute, every minute.
Okay, I make a motion to conclude our meeting at 8:59.
Second, all in favor? Yeah, look, you know what I mean?
Okay, I guess, yep, check, it is 8:59.
Oh, yeah, under 9 o'clock.
Did everybody agree?
Yes, they did.
Okay, all right. Toodles.
Michael, did you get your papers done? Which one? Did you work on all of them?
Thank you, everybody. Thank you.
Good night. Edwin,
Good
thank
night.
you. Oh, he might be gone way from. Bye, oh, let me turn it, let me see. Oh. Oh, you
Oh, this is economic development? Yes. I need to see those, that date, so I can try to make sure I participate.
You mind checking to see if Nicole Barnes?
What, at the economic development?
Do you mind checking to see Nicole Barnes?
I feel one we're gonna be at.
Yeah.
But the third, which is,
I asked her.
which is on a Saturday.
It's a Saturday.
I probably wouldn't be. Good night.
Yeah.
I probably wouldn't, I don't think I would be available, I guess it depends, because it's my
I'm gonna-
birthday weekend, so.
Yes, I'm gonna send you, a letter.
All right, so we talk about the importance of the.
Yes, so for the senior